Hair loss, commonly known as male pattern baldness, is a common condition that affects men. The vast majority of men go bald because of a hereditary condition called androgenic alopecia. The main cause for hair loss in men is an androgen known as DHT, and it is more present in males since it is linked to testosterone. Both testosterone and DHT will bind to the receptors of the scalp, and depending on your genetics, it can cause follicle miniaturization, and over time that causes the hair to thin, shrink, and eventually fall out. So why should you care if you are losing your hair? The answer is simple. In 99% of cases, it will make you less attractive.
Dating bald or dating with hair. I created two different profiles on an online dating app. I swiped 200 times with both profiles in multiple days. And these were the results. My bald self got 17 chances for a date. My hair self got 42 chances for a date. I like this more.
Sure, there are men who can pull off bald looks, but they are extremely rare, and in most of the cases they would still look better with hair. You need the right skull shape and facial masculinity to pull it off, because hair loss has such a wide range of response in individuals. Some men may experience a very sudden and fast hair loss, while others will be only noticeable in their 30s, 40s, or 50s. Regardless of your situation, it is always a good idea to start taking precautions in your 20s in order to keep as much hair as possible as you get older. I am not your doctor, and all the information in this video regarding hair loss medication is for entertainment purposes. Always consult your doctor before starting doing any of this hair loss medications. Start by buying a hair catcher for your shower. This way you can keep track of how many hairs you are losing over time. Start using a ketoconazole shampoo every 3 days and keep it on your scalp for about 3 to 5 minutes. Shampoos that contain the ingredient called ketoconazole are the only shampoos on the market proven to block DHT at the scalp level. Other shampoos on the market may claim to stop hair loss, but unless they have ketoconazole, they won't help. This has a response rate close to 80%. For a lot of men with a more aggressive androgenic alopecia, this won't be enough, so we're moving on to solutions that can work for a vast majority of people. The other way to stop DHT from destroying your hair is finasteride. Finasteride is a 5-alpha reductase enzyme inhibitor that has been approved for the treatment of male androgenic alopecia since 1997, and it is the bread and butter of any hair loss stack protocol. According to the literature, finasteride can reduce scalp DHT levels by around 40% and up to 70% systemically, depending on the dosage. Dutasteride is a stronger 5-alpha reductase enzyme inhibitor. According to the literature, dutasteride suppressed DHT concentrations in the blood serum by around 92% and in the scalp by around 50%. Finasteride selectively inhibits the type 2 isoenzyme of 5-alpha reductase, the enzyme responsible for converting testosterone to dihydrotestosterone, whereas dutasteride inhibits both type 1 and type 2 5-alpha reductase. And that is why dutasteride reduces serum DHT significantly more than finasteride. These two can also be taken in topical form. Topical finasteride significantly improves hair count compared to placebo, and it is well tolerated, although it is not FDA approved. Its effects are similar to that of oral finasteride, but with markedly lower systemic exposure and less impact on serum DHT concentrations. These medications can have side effects, and some men, although a small percentage, are not going to be able to tolerate them. It is important to be under the supervision of a doctor. The literature suggests that if you are prone to have side effects on finasteride or dutasteride, you're going to have them early within the first months. You can observe on this study that most of the patients that get the side effects experience in the first 6 months. It is also speculated that men with below average hormonal profiles, meaning testosterone, are the ones that usually have side effects when taking finasteride or dutasteride. Because free testosterone will still be binding to the androgen receptors of your scalp, ideally you need something to address that part of the androgenic alopecia, and that is why anti-androgens like RU 58841, clascoterone, or piralutamide exist. They have different mechanism of action. While finasteride and dutasteride stops the conversion of testosterone to dihydrotestosterone by inhibiting 5-alpha reductase, these anti-androgens stop the DHT and also circulating free testosterone from binding to the androgen receptor of the hair follicle. The problem is, none of these anti-androgens are FDA approved. Piralutamide looks very promising, and it is currently in phase 3 of clinic trials. Either way, it is not my place to recommend them. Nevertheless, it is never a bad thing to know about them. Now we covered how to stop DHT from destroying your hair. Now we have to talk about what we can do to start promoting and regrowing the hair. And this is when minoxidil comes into play. Whether you choose liquid or foam, it really doesn't matter. Start by applying minoxidil 5% every day directly in your scalp. And to make sure you don't waste your time going through a non-responder phase, just start using tretinoin on the places where you will put the minoxidil. Wait 20 minutes and then apply the minoxidil. Tretinoin has been shown to turn non-responders to minoxidil to responders following 5 days of topical tretinoin application. And it has also been shown that the efficacy and safety of combined 5% minoxidil and 0.01% tretinoin once daily appear to be equivalent to those of conventional 5% minoxidil twice a day daily therapy for the treatment of androgenic alopecia. On top of this, you should do some sort of microneedling once a week, and always wait 24 hours to apply any topical solution. You can boost the effectiveness of minoxidil by about 25% to 40%, while you can expect about 12% hair regrowth while on minoxidil alone. Some of you will have experienced sufficient hair loss to the point where a hair transplant will aid greatly in your appearance. For this reason, here are 2 important facts. 1. The hair transplant will not stop your hair loss. Your hair loss will keep progressing even after the transplant. 2. And this is why you must be on a good hair loss protocol before and even after you get your hair transplant procedure done. The last thing you want is having to do another hair transplant in the next 5 to 10 years because you simply decided to not continue with your hair loss protocol. Now let's say you took no action and now you are very far gone on the Norwood scale and you simply have not enough donor hair in order to do a hair transplant. In this case, you have 3 options. 1. Shave it all off, and if you choose this route, it is advisable to be as jacked as possible in terms of muscle development. Or 2. You get an hair system, it is expensive, and I know some of you would feel weird for using something that is rather fake, but at least there is this option. You don't have to go bald. There are pros and cons of using a hair system. It is up to you to make the decision. 3. SMP or scalp micropigmentation is a treatment using microneedles to deliver pigments to your scalp. And these pigments have to be matching the density and color of your hair. This is a good option for those who want to rock a buzz cut look but are very far gone on the Norwood scale. So at least with this, it can look like they can grow hair. If you're struggling with hair loss, consider getting an aesthetic analysis from me alongside a looksmaxx plan. I can plan and assist you not only on your hair loss struggles, but also in your overall looksmaxxing journey. To get it, either click on my channel or in the description and follow this link. Additionally, you could join my private community where you can talk to me every day and ask questions about anything. Now, let's say you are starting your hair loss stack, and/or you also planning to do a hair transplant. What can you do in the meanwhile to improve the situation of your hair? Let's say your hair is rather thin and it is diffuse thinning. You can use some hair fibers and they will make your hair look thicker by bonding with your own natural hair. And as you can see, it does provide a good result and can be a good way to mask some hair thinning until you wait for your hair loss stack to start doing its job. In terms of hairstyles for receding hairlines, I believe it is case by case. Usually the default thought of people is to hide the forehead and hairline by using some sort of fringe, messy hairstyle. And that is most likely the route you should go if you are a young guy dealing with a receding hairline. But if you're more into your late 20s or even 30s, I think sometimes you will be doing a disservice on yourself by trying to do this because it will make you look more juvenile, but in a bad way. You can observe this with Henry Cavill, for example. He actually looks better while displaying his receding hairline rather than trying to hide it. He just looks more presentable overall. What is the future of hair loss? There is actually a new treatment for hair loss called GT-20029, and it has already performed well in phase 1 of human trials. The reason why this treatment has the huge potential to be the cure for hair loss is because it is an androgen receptor degrader, which means if your scalp does not have the androgen receptors, then it doesn't matter how much testosterone or DHT you have, you will not lose your hair. Now obviously we as men don't want our androgen receptors to be destroyed, but this is supposed to only happen at the scalp level, and it has already been shown that GT-20029 can avoid systemic exposure by limiting skin penetration, and this way it achieves a good safety profile. That's it for today. If you enjoy my content, make sure you subscribe, and if you are new to the channel, I suggest you watch these 2 videos to further increase your knowledge in looksmaxxing.